PCOS is polycystic ovarian syndrome. This is a hormonal imbalance that affects 5% to 10% of the feminine population in the world. It affects mostly women in reproductive ages. PCOS is often and very commonly undiagnosed or misdiagnosed. That is, over 70% of women who have PCOS do not know that they have PCOS. 70 to 80% of women with PCOS struggle with fertility issues. Now, when you hear PCOS, which is the abbreviation for polycystic ovarian syndrome, you see PCOS has to do with excessive cysts lined around the ovaries, which can only be seen with an ultrasound, right? That's one of the most common symptom of PCOS. Other symptoms of PCOS include infertility, irregular menstrual cycle, hyperhidrogen. Hyperhidrogen is an excessive availability of male hormones in a woman. There's a certain amount of hormones a man has in his body, or when that amount of hormone is found in a woman, then it is a symptom of PCOS. It can be in the form of facial hair, hair on the chest, and hair in parts of the body that are only normal for men. Finally, like I said, infertility. Infertility is a symptom of PCOS, probably one of the most common symptoms of PCOS. You are probably wondering what causes PCOS? What are the things that causes polycystic ovarian syndrome? The causes are unclear. That means there is no common or idealistic cause of PCOS, but there are things that lead to the symptoms of PCOS. They are obesity. Sometimes it could be genetic. That is, it could be passed down from your parents or your grandparents or just someone in your family line. And then there's insulin resistance, that's high blood sugar, which also is synonymous with obesity most of the time. So these are the common things that causes hormonal imbalance, which is the major definition of PCOS. So how do we cure PCOS? If you are someone who is experiencing these symptoms, what do you do to make sure you get rid of these symptoms? First one is you should probably visit a healthcare worker, a doctor, for diagnosis. If you have not done that yet, that is the first and most important thing you need to do. You need to go to the doctor to get to go through an ultra scan and to be sure that you have PCOS. Before you can fight something, you have to know what it is, right? Another one is to maintain a healthy weight, exercise regularly, eat healthy food. Another one is to take the pills prescribed by your doctor regularly. I know a lot of people tend to diagnose themselves and give themselves medical treatment off the internet, but it's best to follow your doctor's prescription. And most of the time, they'll probably give you birth control pills to take, or they'll give you fertility pills to take. One of those, and maybe a couple of other things. And then you should also focus on reducing the stress you go through in a day, in a week. You could do that through yoga, meditation, and just resting a lot. Stress is one of the biggest causes of hormonal imbalance. So you fight stress, your hormones become balanced. Finally, regular hospital checkups. Going to get a diagnosis is one thing, or going to the hospital to see your healthcare worker for regular checkups is another thing. So you have to be consistent with that. Thank you so much for watching this video. It was a short one. Peace out. Don't forget to subscribe, like this video, and share. Thank you.